Today I'm going to share with you about a condition called deep venous thrombosis or DVT. Described in the papers as economy class syndrome. Patients who after long distance travel on a flight suddenly collapse and get a cardiac arrest. And the cause of it is actually a blood clot forming in the legs that eventually go to the lungs. It can occur in anyone who is obese, undergoing surgery in the pelvis or lower limbs, or immobile for a long time. Sometimes patients with DVT may have an underlying condition in which their blood is extremely thickened, something called a procoagulopathy, and they are prone to having recurrent DVTs. DVTs frequently occur in the lower limbs, in the calf veins, as well as in the knee veins and the thigh veins. Once the clot forms, they can sometimes break off and fragment and fly off into the lungs. If they fly out into the lungs and they form a big clot in the lungs, it becomes a condition called a pulmonary embolus. And the clot is big enough, it blocks off blood supply to the lung. Patients can then get respiratory failure and cardiac failure, and it is life-threatening. DVT is diagnosed based on symptoms. Patients complain of severe pain and swelling of their calves or their arms, and with inability to walk sometimes. And then when we do an ultrasound, we actually see these clots in the veins of the legs or the arms, and they can extend all the way up to the thigh and sometimes into the pelvis. Once diagnosed, we will usually do a blood test to check on the clotting status of the patient and test to make sure that there's no underlying blood defects that cause clot formation, or what we call the procoagulopathies, or tendencies to form blood clots. We then start the patient on blood thinning medication to prevent more clots from forming in different parts of the body, or for clots to extend on top of one another. In some patients, especially those that have clots or DVT in their legs that extend all the way up into their thigh and to the pelvis, we sometimes are more aggressive in treatment in the sense that we try and dissolve these clots. And what we do is a process called thrombolysis, in which we specifically target the clots under X-ray guidance, and we inject medication or we use a machine to remove the clots. The idea being that the more clots you remove, the less likely that these clots will give long-term problems. And the earlier we do it, patients not only find relief from pain and swelling, they recover faster and have fewer long-term side effects of DVT. In some patients that have had DVT and the clots have not been removed, they're left in the leg, they become scar tissue in the veins. As a result, vein drainage of the leg becomes less efficient, and patients in the long run can get recurrent leg swelling, pain and heaviness, and in severe cases, formation of what we call venous ulcers or recurrent ulcers in their legs. So if you have had DVT or are having DVT or suspect you have DVT, please feel free to reach out to us at the Vascular Interventional Center, where we can help you diagnose and treat this condition effectively.